RMOs and DMOs are mandated to oversee the delivery of quality healthcare services offered by both private and public facilities in the area of their jurisdiction. Allow us to kindly pass this message again to the regional and district authorities to continue working with both sectors without any prejudice, and should use the same yardstick in their dealing with them, and especially during supervision and inspection. Joint supervision visits that include local representatives from our umbrella organization is highly encouraged and welcome. Tuwe pamoja. Honorable guests of honor, as a private sector umbrella organization, would like to present our sincere gratitude to the development partners who have always been joining hands with us to ensure delivery of quality healthcare services in the country through various supports. As an umbrella organization, we have a huge task of building capacity of the member facilities and ensure that whatever programs comes along or directives from the ministry, it is well incorporated in the services of the facility, and also it is sustainable. We do appreciate and recognize the support provided by the development partners, and we would like to request an enhanced private sector engagement to help shape innovations and solutions that can achieve sustained impact for the health sector. Honorable guests of honor, we acknowledge the efforts of the government, all development partners, CSOs, private sector, and the communities in ensuring that the country attains the sustainable development goals. The private health sector is committed to implementing what we have planned and agreed to achieve as detailed in the Health Sector Strategic Plan 5. In particular, the private health sector is eagerly awaiting the passage of the Universal Health Insurance Bill by the Parliament later this year, hopeful to participate and contribute to the attainment of the universal health coverage. After, CSSC and BAKWATA will work closely with the government, Ministry of Health, President Office, regional, administrative, and local government, and other stakeholders to ensure transparency in the costing of health procedures and services, and in the development of strategic purchasing approaches to ensure that both public and private health facilities deliver quality services to all people of the United Republic of Tanzania, when and where needed by them, without the risk of financial hardship. Honorable Chairperson, kindly allow me to wish all of us a successful meeting with fruitful deliberations. Asante sana kwa kunisikiliza na kwa kupokea ujumbe wetu.
Asante sana, nashukuru sana mwakilishi Dr. Josephine Balati kwa maneno, nashukuru. Naomba sasa nichukue nafasi ya kumkaribisha DPG Health Dr. Jema Bisimba. Nikuombe tafadhali sana, muda wetu pia sio rafiki. Kwa hiyo karibu. Na wakati huo pia taomba NSA representative ajiandae, na kisha baada ya hapo pia nimepokea taarifa mwakilishi wa WHO pia amefika. Kwa hiyo naomba naye pia ajiandae kwa dakika chache kwa ajili ya kutoa salamu. Asante sana. Dr. German Bisimba, karibu.
Asante. Habari za asubuhi. Habarini za asubuhi. Asante. Mheshimiwa mgeni rasmi, na sisi pia naomba kwa ruhusa yako tutoe salamu zetu kwa lugha ya Kiingereza ili wenzetu pia wanaotufuatilia hapa na wengine ambao wako mtandaoni waweze kufuatilia. Honorable Deputy Minister of Health, Dr. Godwin Mollel, Honorable Permanent Secretary, Professor Abe Makubi, Deputy Permanent Secretary, Dr. Grace Magembe, regional and district medical officers and medical officers in charge who are present here, government officials, representatives of CSOs and the private sector, fellow development partners, invited guests, ladies and gentlemen, good morning, habarini za asubuhi. It's a pleasure for me to be here this morning to give remarks on behalf of the Development Partners Group for Health at this year's RMOs and DMOs conference. As we are learning to live with COVID-19, but also responding to new threats. And as we plan to ensure universal health provisions to all citizens, this meeting today and throughout the 3 days will provide an opportune time to reflect to our health service deliveries to date. It is also the time to set the vision and strategies to improve quality services to all Tanzanians, but also build on the decisions made in the Health Sector Strategic Plan 5, an important strategy to deliver health sector objectives over the 5 years. Honorable guest of honor, first allow me to congratulate the government and everyone in this room for the great progress that we have made in vaccinating a great number of Tanzanians' population with COVID-19 vaccinations. As of February 10, I think as we all know, Tanzania has fully vaccinated more than 31.9 million people, which has surpassed the target of vaccinating eligible populations, who are adults aged 18 and above. This is a massive achievement and a success that is down to the efforts of all of the healthcare workers under your leadership and that of the RMOs and DMOs who are here today. Last year, we were faced with the threat of an Ebola outbreak in the region, and through the leadership of the government, we were able to mobilize the public and private sectors, development partners, and civil societies, and we were able to keep Tanzania safe. We should also celebrate the progress that Tanzania has made in the last year in producing data for health and development, the Census 2022, and the Tanzania Demographic Health Survey of 2022. These are impressive bodies of work that will inform police decisions, but also resource allocations for years to come. And comparing with 2015 DHS, we know now that under 5 mortality has declined from 67 to 43 per 1,000 live births, but also that of prevalence of malaria in children aged 6 to 59 months has decreased from 15% to 8%. And for all this, I think we all deserve a round of applause. Tujipigie makofi tafadhali. Asante. So these results show that what can be done when there is a strong national leadership and the know-how, which is coupled with technical and financial assistance from partners. And equally, I would like to congratulate the government for the continued effort in expanding access and improving the quality of services to all. This year's theme, improving quality of healthcare, is vital towards achieving universal health coverage, and its sub-theme is the implementation of quality improvement prioritizing the Health Sector Strategic Plan 5 on track. Could not have been appropriate at this moment. The health system is emerging and recovering from managing what I think one of the greatest challenge in the health system for our time. It is therefore the right time to reflect on how and whether the priorities identified in the HSSP 5 on quality improvement are on track. And as it rightly says, universal health coverage cannot be achieved without prioritizing the quality of care. I believe in the next 3 days, we'll use the opportunity to review and reflect on the areas where we have done better and where further improvements is needed to achieve quality improvement. Honorable guest of honor, allow me again to speak a little bit on the quality of services as we observed from the recent joint field visits, from which I also participated, and I know that there will be a session about discussing the findings, so I'll be very brief. As development partners, we appreciated the opportunity last week of visiting the health facilities in 3 regions, which were Kilimanjaro, Singida, and Njombe. And we also appreciated the opportunity to speak with the RHMTs, CHMTs, the healthcare workers, and to some extent, the beneficiaries of the health services. Although this was just a snapshot, we think that the regions and facilities visitors provided a good sample to understand what is feasible, what are the drivers of quality improvement, and the outstanding challenges. We all know that when we measure quality of care, we are basically asking, is the healthcare services effective? Is it safe? Is it reliable? Are the people getting services in a timely manner? Is it people-centered? Is it accessed by all the people regardless of their identity, location, and income status? Do the health services users feel satisfied in how they were treated? So in the facilities we visited, we observed a mixture of performance. But all in all, the trajectory is going on in the right direction. Infrastructures for service delivery is improving and is increasingly becoming closer to the people. Facilities are increasingly equipped with appropriate equipment to improve diagnosis, and the availability of medicine is encouraging. And in the majority of facilities we visited, availability of tracer medicines was between 90 to 100%. And that of essential medicines were between 50 to 75%. And at the same time, there were efforts to improve process and systems for quality improvement. And as a result, there has been a subsequent increase in utilization of services from the community, which was also seen in the improvement of revenue collection by the health facilities. Also, we observed that governing committees and other relevant committees for overseeing quality improvement are in place across all facilities, and in the majority of the facilities they were functioning and they were very instrumental in improving the quality of services. However, challenges still remains. And we think that if not addressed in a systematic and phased manner, it will drag our efforts to achieve quality services and universal health access to all. One of the challenges, and I think which of the one we all know, is the acute shortage of human resources for health. In the facilities we visited, shortages of human resources for health is between 50 to 60%, with the impact on the staff workload, the type of services they could offer, but also the quality of services. It was encouraging, however, to note that in some of the facilities, the health management teams, in collaboration with the councils and development partners, are deploying various measures to ease the shortage, such as contracting additional healthcare workers, but also getting volunteer health workers. This is welcome, but we all know that it can only be feasible in huge and better resource facilities and cannot be widely spread. We also noted that there's a critical element of system that seems to contribute to service improvement is the frequency and effectiveness of supportive supervision from CHMTs and RHMTs. Our observation from the field, again, is that in some councils and regions, these supervisions are happening as scheduled, and the health facilities are really appreciating them. However, in some councils and regions, the lack of financing, especially for fuel and vehicles, has been a significant constraint that impede regular